My name is Paul Silverman. I was diagnosed with Parkinson's disease in the late 90s. I started showing initial symptoms in the early 70s, and at the same time started having chronic back pain, which has become increasingly severe as my Parkinson's symptoms have progressed. I have turned off my DBS stimulators. I had DBS surgery in 2008, and I'm making this video because my frustration is that my back pain does not seem to be related to any kind of pathological condition in my back. I think it's related to the Parkinson's disease directly, because as I find my Parkinson's disease symptoms worsening, the pain is getting worse. I turned off my stimulators because I want to demonstrate that despite the severity of my symptoms, I am able to function normally when I focus all of my attention on my movements and my speech, and can actually have a normal neurological exam. I'm on no Parkinson's medication. I have been on no Parkinson's medication since the DBS surgery. I just want to demonstrate what my gait looks like when I am not giving my full attention to my stride length, swinging my arms, and all of the other things I do to compensate. Okay, so now I'm going to show how I can control the tremors and function in apparently a more normal manner. Now I can do this at the drop of a hat, obviously, and can do this indefinitely. The advantage of the DBS surgery is that it makes it easier on me to stop the tremors. This is something that I'm consciously doing, and even when I have my stimulators on, I still have tremors, because I find if I turn the stimulators up high enough to completely eliminate the tremors, my speech is impaired. I will show you what my gait looks like when I'm actually focused on every step and focus on swinging my arms and all the other things that a normal person would do when they're walking.
Stand up on one leg.
I have such control over my tremors that I can actually allow one body part to shake and still keep the rest of my body still. And I can do an arm, I can do both arms and one leg. I actually have enough control that I can do one finger. But all of this takes a great deal of concentration. the hardest part of all of this is that everything that I do is choreographed. Every sound I make when I talk, I think about what I'm going to say before I say it. I'm acutely aware of the position of my tongue, of my lips, how loud I'm speaking. When I'm walking, I am aware of how long my stride length is, how high I'm picking my feet up. It takes a great deal of concentration to overcome these symptoms. As an example, my swallowing had become a severe problem, and I was gagging on my own saliva routinely. Obviously, this is something I was very concerned about because aspiration pneumonia is a major problem in Parkinson's patients. And to resolve the problem, I started chewing gum and eating hard candies, forcing myself to focus on the swallowing process and focusing on the actual mechanism of swallowing correctly. Since I've done that, I've had almost no episodes of choking, but every time I swallow, I have to shift my attention to swallowing. So, I understand that this kind of defies the conventional wisdom of Parkinson's disease and the course and the treatment, and I think that probably all of this compensation and fighting the stooped position and fighting the tremors and keeping my balance and doing all these other things are a big problem as far as my back. When I say I have chronic back pain, I live on large doses of narcotic medication, and most days it does nothing to touch the pain. It hurts to breathe most days, and my frustration is that I think unless someone really understands how much I am working minute to minute, second to second, to function on a level that theoretically I should not be able to function after all these years with no medication, they can't possibly begin to address the back problem.